Well, thank you everyone for being here today. Um, and thank you, Sadia, for introducing us. Our topic is a public health approach to gun violence prevention. And this is a topic that to Jacksonville specifically. And I'm also just wanted to thank Sadia and Dennis, who can't be here today, for giving me the opportunity to touch on and talk about this topic because it's really important. So, yeah, so we're gonna get started, and like I mentioned, Dennis Stone is the director of the Jacksonville Urban League, and he's not here today. But we also have Sadia Barge, who you just heard, and she is our intern coordinator. They've been helping me do research on this topic and put this presentation together. And then there's me, I'm Maya Arrington. I'm an intern here at the Jacksonville Urban League Center of Advocacy and Social Justice. And I'm also a Master's of Public Health student at George Washington University in Washington, D.C. And I also have my bachelor's in psychology from Christopher Newport University. And today we have the lovely guest speaker, Katryne Lukens Bull. Katryne also has her MPH, and she's an instructor in the Department of Public Health. She also is a program director for the Bachelor's of Science in Health, and she's an active member of the community. She's involved in several initiatives such as Drug Free Duval, the School of Advisory Council, and Jack's Youth Equality. I also had the pleasure of working with Katryne early in the year on the same topic of gun violence prevention. We were able to just pitch some ideas and create a framework for the city of Jacksonville. So thank you, Katryne, for being here. We also have a second guest speaker, which is Cameron Bertrand, fellow CNU alum. Cameron wears many hats. He is a national activist, he's an author, he's a mental health counselor, he is a CEO and founder of Gun Violence Intervention and Prevention Outreach and Research Center, the Violence Intervention and Prevention Organization, founder of Buy Back the Block and Beyond the Bullet. And he provides counseling, mentorship. He's passionate about advocacy. And so we're really excited to hear about his story as a gun violence survivor and the different initiatives he's a part of. So if anyone has any questions, be prepared because you have some really great people who are very knowledgeable about this topic. So it's a little overview of what we're going to talk about. We're going to briefly talk about gun violence in the United States, and then specifically Jacksonville and why it's known as the gun murder capital of Florida. We're going to talk about youth violence, and then we're going to look at a public health approach, which is what I think is very important to point out. And then we're going to look at a conceptual model and also the importance of grounding in behavioral theory. We're going to look at violence intervention programs and hear from Cameron. And then we're going to end off with prevention strategies. So to get started, the statistics on gun violence in America. And so understanding the statistics is very important in comprehending the societal trends and informing policy decisions. And so this is one of the reasons why we're having this conversation, because we want to see real changes. We want to see policy changes. And that starts off with us being knowledgeable about the data and the facts as well. So as you see here, every day, 327 people are shot. Every year, 117,345 people are shot. Every year, 7,957 children and teens are shot. And every day, 124 people die due to a gun. And these are statistics that I got off Brady United, which is a gun violence organization. This was up to date as of 2024. And they also gathered these statistics using credible databases like the CDC. So there are the hard numbers of the rising crisis of gun violence. And so Jacksonville, also known as the murder capital, the gun murder capital of Florida, um, is important to talk about because for years, Duval County has had the highest murder rate of Florida, and 80% of those murders are with guns. And not only is it known as the gun murder capital, but it's also known as the state with kids who kill. And so in the last decade, 73 Duval County children have been arrested in cases of murder and manslaughter. And so you're probably wondering, why are so many Jacksonville children involved in serious crimes at such a young age and getting involved with guns? And that leads me to talk about these risk factors that are contributing to this issue, and the Times Union research revealed four overarching contribute factors, and that is trauma. There's trauma. Most of Duval County kids who end up convicted of a murder have a history of distressing events happening around them and to them. And it's important to know that trauma is often a constant companion in these kids' homes, their neighborhoods, and their schools. And that also leads to the issue of like family dysfunction. And so the survey that the Times Union research did found that 84% of the survey respondents had divorced or separated parents, and just as many lived with someone who used drugs and alcohol. And then there's also a violent environment. And 84% also said that they have either been shot, and 72% had witnessed someone being shot. And more than a third said that they had a close family member who was murdered. And then there's also dangerous peer influences that are a contributing factor. We know that teens tend to follow the stronger influence, not necessarily the positive one. And so this is leading into why this is a public health problem and why we need a public health approach to this. So that's why I'm pointing this out right now. And I'm going to pass it over to Katryne to talk a little bit more about gun violence in Jacksonville and what's happening to children over there. So go ahead, Katryne.
Thank you. So, just so you know, I am an instructor at University of North Florida in the Department of Public Health. But before joining them in 2019, I worked for a couple decades at the University of Florida College of Medicine in downtown Jacksonville, looking at public health problems with physicians and other community members. And so some of the research I'm going to talk about today came from those years of experience, and I've stayed in contact and still run data, look at surveillance and things that we do in epidemiology to try to understand what's happening in our communities. So I was approached by Dr. Marie Crandall, who is a trauma surgeon at the University of Florida in Jacksonville. And she had moved here from Seattle, where they have Harborview, which is their main trauma unit. She's a wonderful trauma surgeon and also has a public health background. And she was really disheartened to see how many trauma patients, both pediatric and adult, were coming through her trauma center and needed to be, have these very intense interventions. And her as a surgeon, she's like, what is this? What's going on? And so we looked at 20 years of pediatric gunshot wounds that came into University of Florida. So these are not people who died. These are people who made it to the University of Florida down on 8th Street, and 99% of them survived. So these are the pediatrics, and then we did another study on the adult population. Same story, the ones who survived. So we're not talking about the ones who actually died from their GSWs or gunshot wounds. And what we found, one of the contributions that I made along with other researchers, was to look at the geographic areas within Jacksonville that were experiencing the highest levels of gun violence each year for those 20 years. And we also looked at something called a area deprivation index, which means that those who are in the 95th to 100 percentile have the lowest amount of resources. Those who are in the 75th to 94th percentile have very few resources, and those in the 0 to 75th percentile have a wide variety of resources. And the reason that we divided it up that way is that we see other health outcomes related to this deprivation index that doesn't just take into consideration your income, it takes into consideration home ownership, crowding, vehicle ownership, transportation issues, having access to healthcare and insurance and things like that. So when we looked at the areas that were suffering from the most GSWs in the pediatric population, we really saw that they were closely associated with the same areas that had very low economic resources and economic capital, and that these areas have sustained this for over 20 years. And so you can read the quote from Dr. Crandall that despite, our policing efforts and really well-intentioned efforts over all this time, this has been just really endemic to our Duval County geographic area. And in addition to this slide and research on here, we also did the adult population. It was an even tighter geographic area, centered on the same areas of deprivation that we've had. Dr. Crandall asked me additionally to see if I could quantify gentrification and determine if any gentrification issues had happened and maybe alleviated some of those pressures in different areas. It's very hard to quantify that over time. But one of the interesting things that I thought that did come out of that was that we really narrowed it down to a geographic area that included about 50,000 residents of Jacksonville. So when we talk about gun violence in Jacksonville, it's not that we have to maybe address all the areas, the million people who live here in Jacksonville and their needs. We see that if we could really focus in on a small number of neighborhoods and do something different for them, maybe it would change this outcome with our data. And especially, for our pediatric population, but also our adult population. Again, this data does not take into account the actual deaths from gunshot wounds. These are people who have been injured, and most of them have survived those. And the other thing that I will add, just as a university professor, I use this slide often to talk to my class about how to measure something more than socioeconomic status or income using the area deprivation index, and also about the real, toll that gun violence has on our pediatric and adult population. And I've been really saddened to see that almost every semester in my class, there will be at least one person, one young person, college age, who says, I've suffered from gun violence, that they've been shot, someone they know has been shot. This is just something that seems to affect so many people that, we don't really always think about that it's affecting so many people and so many lives. So, Maya, thank you.
Yeah, thank you. And I just want to add on, I love how in this quote you mentioned despite policing efforts. And during my research, I see so many times, not only in Jacksonville, but in a lot of other cities around the US, it's like policing is also one of the first things that cities like to go to. And as you can see, we're not seeing change. And so that's why I think it's so important to bring up this public health approach where we're looking at the different factors that are contributing to this outcome, and then also like the population where we're seeing this happening in. I also wanted to add on too, I didn't mention this, but nearly 94% of those killed in Jacksonville are Black men and boys, and more than half of those victims are under the age of 30. And so we're seeing there's this obviously this specific demographic. And so if we're just getting only policing, that's not going to really solve of the real deeper issue of this. And so that's why we need to get together with people like you who are public health professionals, people who are actually in the community that are being affected by this, and then other, people from different professions like mental health and as well. And so, yeah, thank you for sharing. Um, and going off of that, that's why I mentioned a public health approach. Like, this is so important into trying to, talk about this issue. And we have seen a public health approach successfully eradicate diseases, reduce smoking related deaths, decrease car crashes. And for that same reason, a public health approach should be implemented when trying to solve gun violence. And I wanted to point out the four main objectives of this approach are to define and monitor the problem, identify risk and protective factors, develop and test prevention strategies, and ensure that these effective strategies are being adopted. And that one's really important too, because I know a lot of people who are on this call right now weren't on earlier at like 6:45, but Cameron brought up like, a lot of people like to talk about this, but then it's like, and then it's like you check a box and then say, okay, we talked about it, but then what happens next? And so with the public health approach, that last factor is very important because we need to ensure that these strategies are being adopted, and then we're seeing it play out. And that's another thing that we see fail, especially with the Cure Violence program. And I'm sorry not to put you on the spot, Katryne, but do you know anything about the Cure Violence program there in Jacksonville, or like any latest news about what's going on with that? Because last time we spoke, I've heard that there was defunding the Cure Violence program. And for those who don't know, Cure Violence is a violence intervention initiative that adopted a public health approach, but we're seeing that in Florida it's being defunded, and I don't know, is it canceled as well?
I am not positive about the funding. The last I heard was that it was deemed not effective, but the resources that were given to that program were not such that it could be implemented with fidelity as it was in other areas. And so that's basically all I know, that some of our public health and community members don't think it's really fair to say that it would not be effective if it was actually implemented with fidelity and given the resources that it needs. But that's all I've heard. Thank you.
Yeah, no, thank you for sharing that, because the research I did too is that I saw the same thing, that it lacked fidelity, and we're not seeing like follow through really, which is exactly the last point that I'm trying to make with the objective, ensuring that the effective strategies are adopted. It's like we're seeing people are starting to realize that this is a public health problem, but then they back down, and we're not seeing the follow through with this. So yeah, that's one of the reasons why this public health approach is very important. And so specifically, I came up with this conceptual model to provide a framework using a public health approach when trying to come up with a gun violence program per se. And so having it be a public health approach, I looked into predisposing factors such as, the misconceptions of gun violence, the lack of knowledge about guns, lack of self-efficacy to seek professional help, and also the high perceived barriers to seeking mental health services. So these are all predisposing factors that could be possibly changeable by a program. And then there's reinforcing factors, which are the external and social factors, such as cultural norms and stigma, lack of family support, lack of social peer support. And then there's also enabling factors. So the external or skill related, which is inaccessibility of mental health and community services and programs, and lack of targeted education. So all these factors are then influencing health risks, behavioral risks, and environmental risks. Or health risks could be, there's probably a family history of mental health concerns or trauma that could be contributing to this. There's also behavioral risks such as alcohol and substance abuse, antisocial behavior, poor school performance attendance, and even involvement in gangs. And then there's the environmental risks, which this is one of my favorite ones to emphasize, because it's pointing out that there's also risks that are sometimes outside of these individuals' control, which is poverty, marginalization, lack of affordable housing, discrimination, bullying, and high unemployment. That's another reason why I really love the public health approach, is that we can include this when trying to come up with the solution, and this all can help prevent, during this conceptual model, is high rates of gun violence among adolescents in Jacksonville, Florida. And so, yeah, this is a conceptual model that I loved doing, but I also feel like it's so important when trying to create a framework, when we're really trying to make change. We need to have things like, yeah, this specific where you're able to see, so that way we can adopt it and we can go back to it and feel, okay, where are these children that are getting involved in gun violence? What's the environment that they're in, what's the stigma, the cultural norms that they're involved in, and then trying to, talk about these issues when relating to gun violence. And I also wanted to point out that grounding in behavioral theory is really important, because we want to see behavioral change. And one of the reasons why grounding in theory is important, because it helps replicate findings. So when you're doing research and studying, when you have it grounded in behavioral theory, it can help contribute to that. It's also an ability to guide evaluation, and then it also helps provide thoughtfulness in developing messages. So one of my favorite behavioral theories is the social cognitive theory. And one of the reasons why I like it too is because it includes the individual themselves, their behavior, and then the environment that they're in. So, the emotional state, cognitive state that that individual has, the learning, action, and performance of the behavior, and then that social and family support that is also contributing to the issue of gun violence. And the social cognitive theory, for example, is one that's based on individual learning. And as a result, social cognitive theory examines like a unique way that individuals maintain behaviors, so that we can see, a long lasting change. We have to understand why they're acting this way, what's leading them to participate in this. And then I wanted to add this quote in here, so we can understand, we know that there's some programs out there, like I just mentioned, Cure Violence. And there's a lot of people that are very passionate about this topic. But historically, we have seen that violence reduction efforts have failed, because these programs that are aimed at both individual level change and aggregate level change have not been able to reach the high risk individuals that are actually involved in the community's violence problem. So again, that's pointing out that these programs sometimes are not even really involving these individuals that are actually in this that are experiencing these issues. We're not hearing from them. We're not really including in what their needs are, so that we can better tailor um, programs or initiatives to help solve this problem. And so I got this quote from the Annual Review of Public Health. And then I wanted to turn this over to Cameron. So Cameron can talk about the violence intervention programs that he has founded and how that is going for him. Because it's great things that he's a part of, and it's obviously you can see that's going very well. And also just to hear a little bit about his story as a gun violence survivor. So, Cameron, I'll turn it over to you.
Well, hello, everyone. I'm calling in all the way from Virginia right now. I'm in Newport News, so I hope the weather is better down there than it is here right now because it's cold and rainy. But with the climate of not only gun violence in America right now, but some of the work that I've been able to do nationwide as a subject matter expert for gun violence prevention, but for primarily the focus with mental health and how we can prevent these issues before they happen. And and in doing that, my background is in qualitative research. It was really important for me to utilize that with qualitative research when we're talking about best practices and evidence-based research and the things that actually work in places that we need them. So as we've spoken on today, even with the idea of gun violence being a public health concern, what does that even mean? Or how do we address this as a whole? And so currently, the organization that I started 5 years ago was Violence Intervention and Prevention, VIP LLC. That was my first baby. And the mission was to make sure that we're impacting youth and adults that are currently suffering from or at risk of violence and trauma, but cultivating a life-changing perception of success and community responsibility. So when we talk about perceptions of success, with the data that y'all have seen, even on this Zoom call today, we're talking about young people. You said 92%. Maya, like that's 92% were what, young Black men, I think it was, and under the age of 30. Like we're talking about the idea now for most young Black men, not just in that area, but specifically in Jacksonville. We're asking them to conceptualize a reality based on future reward for current incentives that they may not even believe that they're going to be around long enough to face the consequences for the actions they're making today. So to get people out of survival mode, to actually think, what does it mean? What does it look like to impact people who don't identify with the solutions that may be presented? That is where qualitative approaches are absolutely important, because every city I go to, we now operate in 8 different states. So it does not mean that the work that I've done in Louisville is going to work in Minneapolis, or the work that I've done in Minneapolis is going to work in Baltimore or DC. So the thing that we've been able to do is focus on what people have spoken on and prioritized. When we talk about gun violence being a public health crisis, back in 2020, we saw that COVID hit the streets and we were constantly talking about stopping the spread, stopping the spread, stopping the spread. So if we think about violence in a sense that violence is a learned behavior that is learned through interaction. I don't believe that anybody was born violent. I don't believe that's the case. So when we talk about the interactions that people are having, again, we're talking about outweighing the negative interactions that they're having with positive ones. And that was mentioned previously today. So to change their perceptions of the reality, to change perceptions of the interactions they're having, and for them to be able to see themselves in the solutions and future reward. So things that we've been able to do in Hampton Roads here in Newport News, Virginia, and throughout Hampton Roads and Norfolk, Portsmouth, and different areas in the Tidewater area of Virginia, gun violence has been to the point where we needed to make sure we can create an immediate response to an immediate problem. So for me being a gun violence survivor, when I was shot, me being shot wasn't the worst part. It was the fact that people saw me laying on that ground and did not help. I was in a position where I had to, me and my best friend were laying on that ground, and we were innocent people involved in a violent crime. So when you talk about victim services, what is being brought to the attention and to the capacity for people who may have just suffered a gunshot wound? Do we have hospital-based violence intervention programs to make sure that there are people who can make contact with the survivors and the victims immediately? That could be the difference between retaliation, which is a big part of gun violence, no matter where you go. But to make sure that people feel seen and feel heard in every capacity, right? There are so many things that surround victim services and victim compensation and what that even means for people, if they're innocent, if they're not, and if they're being even given the resources that other counterparts may be given. And whether that's based on poverty, whether that's based on the access, or whether that's based on knowledge. So my job is to make sure that we not only educate, organize, and mobilize, how do we connect people to real solutions that are trauma-informed, evidence-based, outcome-driven? Those three things are really important. And with the qualitative responses we receive, we're able to make sure that evidence-based means, are we doing the work that actually matters to people for the positions that they're in currently? And are we able to create longevity and create programs that are outcome driven to make sure that they sustain the resources that people need as they go through their healing journey? Because without getting people out of survival mode, it's very hard to ask people to be the productive, caring citizens of society that we need. So that's been my main job. There's been different ways of doing that, whether we're in the detention centers to make sure that we're intervening with people who have not only been impacted, but who may have been involved in shooting. Are we addressing on both sides and making sure that people aren't creating or recreating a cycle that may have not only been learned behavior, but based in trauma, as we mentioned here, and generational trauma, to have people who are born into trauma and born into things that they may not even be able to see. And that's absolutely real. With me being a gun violence survivor, there has been 3 generations of people in my bloodline that have been impacted by gun violence. My main job as a young Black man, and I'm 33, I know I may not look it, but my job as a young Black man is to make sure, how can I do the work in the healing now to make sure that this isn't something that's passed down if I have a young son, right? But to also know that there are things that we have to advocate for at the highest level, at the city, state, and federal level, because people are falling through the cracks. And the resources not being created, sustainability for the programs. So when we talk about elected officials in the areas that we're in, we have what is not only an ethnocentric mindset, but this political hegemony. People are creating policies and creating things that are not actually advocating for the people being impacted by these laws or the lack thereof, right? With the access to resources, are we addressing the environmental issues that may have been rooted in redlining and other things? Gentrification is a product of making sure that certain people have access to certain resources. And that's not always based on skin. People don't realize that Black people can gentrify neighborhoods too, but we don't have the power and equity to do such, which is why we don't identify with these terms. So identity is huge with the representation, with the resources that we need to see. When we talk about not being able to police our way out of these issues, there is no evidence that suggests that policing has ever been able to reduce crime or violence. And we have actually been able to produce evidence that shows that more police involvement with people who are unfamiliar with the communities that they're patrolling can actually create more trauma on both ends. So focusing on issues and people and solutions and putting them in places to where we talk about money and we talk about the lack of resources that's being put into our funding that's being put into resources. Our government spends over $34.6 million a day in the aftermath of gun violence. That means responding to gun violence. That means going into communities and having to go do the work, fund the work that it takes to respond to these issues. Can we actually use even a percentage of that on prevention to prioritize prevention before these issues happen? When we talk about gun violence, do people understand that there's also more ways for us to prevent the issues that are happening where people are not only being impacted by gun violence, but we focus on bleeding control a lot now too? Because the number one cause of death after injury is bleeding. So without that access, without that knowledge, people are not even in positions, and we've had several, unfortunately, young people that have bled out constantly in the areas that we live in right now. And it's something that with the school shootings and different issues, access to these weapons is a huge problem, but guns don't kill people, people do. Can we actually change the mindset and the capacity of a person who has the capacity to pull the trigger, whether it's out of fear, whether it's out of lack of identity and wanting to find that identity in false ideologies? And for us, we've been able to even create trauma recovery centers. And I think that would be something that would be amazing for the city of Jacksonville. And I hope to be able to continue to build in this capacity to help in the capacity that came with that. But our trauma recovery center was something that I know that I needed and several people needed after we were recovering from our gunshot injury, which means that a place for people to go that's free, that they can go without insurance, if they do have insurance, to go and work with peer support in peer support environments, which means that they can speak with people who have been through what they've been through and understand what they have been through as well. Making sure that we connect with the HVIP programs, which are the hospital-based violence intervention programs, and making sure that there's connection and communication on both ends. Making sure that we advocate at the General Assembly for the lack of funding or the lack of advocacy we may have. And we've also created crisis hotlines to make sure people have 24/7 access to these resources, even if they can't get there in person. And these things were created with the funding, with funding, without funding, whether it was with the mutual aid, whether it was through crowdfunding and community efforts. But the most important piece was that we did it together as a community. It was a grassroots effort. And without that, there was no way we can guarantee that people don't fall through the cracks. So I think those are the issues that with our programs nationally, we've been able to see real results from real people who have been able to tell us, this is what we needed, this is how it was created, and thank you for tailoring it to our communities. So I'm thankful for my background in sociology and criminology because it taught me how to be a qualitative researcher. I'm thankful for my background in anthropology because when I go into different unfamiliar communities, I know how to go in and still study without extracting data and not making sure that we leave people with the resources to help themselves. So I'm thankful for that opportunity as well. But Buy Back the Block is a way to make sure people understand that we have to take back the communities we live in. We have to take back the communities that we have grown up in, and we have to create ownership and representation, because without that, people do not feel like they belong in the communities that they grew up in. And that's part of the problem. And I think that morale is a big part of that, and ownership, because people don't tear up things that they feel like they're a part of, right? So Beyond the Bullet, and that's the last thing I haven't mentioned, I think, on my slide, but Beyond the Bullet is an environment to make sure, and it's a peer support network. So all of us, unfortunately, in some way, if you're on this call, I am 99% sure that you have been impacted by gun violence. And there's a big chance you may even have urban traumatic stress disorder just from the impact that it may have had on your life as well. So I became a counselor to help fill those gaps in those areas. But all of these things that we've been able to do have been because of the fact that it was a need that was created and assessed, and we've continued to do our research and our work and our due diligence to fill those gaps.
Wow. Thank you, Cameron. That was just great information. And I think for everyone listening, Cameron's just a success story. He's also an inspiration as a gun violence survivor who saw an issue and the way that his experience impacted him, and he created a change, and he created these programs. And I think that's something that we should not only just look at and maybe be in all of, but like support, because a lot of these people, like it takes a lot of hard work, and we're seeing that the issue of gun violence is starting to like sneak in all areas around in the US. And I think it's very important, everything that he just shared, but also for you guys to visually see these are violence intervention programs that are out there, might not be in Jacksonville, but it's working. It's worked for him, and it also can work for a lot of other people if we implement a lot of the same strategies that Cameron is doing. And so with that being said, um, thank you, Cameron. That was great. And um, I wanted to end by just talking a little bit about prevention strategies. So Cameron mentioned obviously a lot of great ones that he's been applying. So we got some really great examples, but developing evidence-based interventions to address identified risk factors, redlining, um, the housing crisis, um, discrimination, racism, all these factors that are contributing to or leading to people to get involved in gun violence, grounding in behavioral theory, public health system approaches. What does that mean? How can we do that? And then also community engagement and partnership. This is a prime example of community engagement and partnership. We have members from the community here on this call. We have people that a partnership, Cameron and his organizations that he's a part of. We have interns here. I see today, I see Nuo. Sorry, not to put you on the spot, but Nuo is working on similar topic on this. And they're from all around the world. They're not just here they're in Florida. Well, I'm not in Florida, but they're not over there in Florida. So this is just a great example of people getting together, interdisciplinary professions coming together, sharing their knowledge, sharing their experiences, and together we can generate ideas to advocate for change. So that's the main purpose of even this event right here. Yes, we just spilled out a lot of information, but the reason is that we want to put this in your head. We want you guys to see what is being talked about and what the issue is. And then from here, we want to, continue this conversation and share this with, like Cameron mentioned, people at the local level, at the state level, at the federal level. And I think that it's possible. It's very hard. And I don't know if Dr. Goldhagen is here with us. Yeah, he couldn't make it, but Dr. Goldhagen, I would love to connect him with you too, Cameron. We worked with him earlier about this topic, and I know he can probably share his frustration too with this topic, and he has a lot of experience. So I guess I'm
I
just
mean, think about it, y'all. Like, we have 11 people on this call. Like, this is a coalition already. We got Ebony up here. She's with Hampton University now. Like, we got enough people on here to make a real life issue. But what you all have already done, because you have brought a gun violence survivor onto a platform where I have heard this term. I've never heard the term murder capital of any state. Like, I used to live in Pensacola, Florida. I was a military kid, but this idea and concept of everything we just heard today, every number, that is quantitative data, but those were real people, y'all, that lived real lives, that had real legacies that we're talking about now. We have this information. What do we do? And I ask people when we do come together, because this is a heavy topic, if you're actually thinking about it and thinking about it in depth in a way that matters, you're going to leave this call, you're going to feel some type of way. You should. If you haven't, then you didn't do something right. But I'm telling you now, we have solutions. We have a way to make sure that this does not continue. How do we rebrand the city of Jacksonville? How do we create lasting change in things? And this is where it starts. right? So I just want to make sure we challenge people, like, leave here with a call to action. If there was something that anybody spoke today on, like if it wasn't myself or Katryne or Maya, like there has to have been something. And if it wasn't, use this Q&A portion that's coming up to do so. But I encourage everybody here to make sure we have a call to action for the next time that we all get together, because this is where we get this ball rolling. And I think that we have a way to bring the best practices from everybody on this call and from the 8+ states that we're currently working with, and to do something about this. Duval County has had a reputation for too long, and I've heard about that my whole life, but I've never heard that term in writing or seen it. And my heart is hurting. Like this that's we're talking about now, 10 to 20 years of generational trauma now. Like that still has to be fleshed out. If we started now and saw a decrease in the next 10 to 20 years, then we could actually think 7 generations from then that Jacksonville would be perfect, right? So it's like we're looking at a long-term goal. I do get that, but this is how it starts. So I just wanted to add that on there because, again, as a gun violence survivor, it's not always easy. It is a burden sometimes to do the work that I'm doing, because all of it was created because I saw gaps in areas that I could have felt through myself. I have no questions on why people go and feed into their feelings with gun violence. When there's retaliation, things is going, I have understood those exact feelings. When I was left on that ground, as I mentioned, it sucks. And it made me feel as if I wasn't important enough to receive a lot of the solutions we're talking about today. Please understand that we are going to ask people to stop doing something that is tearing up our communities, but most people are doing it out of fear or out of learned behavior. I'm here to tell you that. And so I was able to be blessed with a village around me that compelled me to find a different way. And 8 years later, y'all, I'm still partially paralyzed from the knee down. I still sleep with a boot on my leg. Every day I wake up with a reminder of what happened to me November 7th, 2015. Every day. And every day I could be fed up to the point where I'm like, I'm done with this. But the people even here today have been a big part of the reason why we keep moving forward as survivors. And everybody here is a survivor of something. So I ask us to not wait until it's you or somebody you love to start putting our best foot forward with gun violence. Like we're the only nation that deals with this problem at this level. It's on us, and it can end with us too.
Thank you. Yeah, that's a great way to transition into the questions. So I'd like to take the time if anyone has any questions. I know we gave a lot of information, and if someone wants to ask our guest speakers today a little bit more about themselves, the research that they're doing, the initiatives that they're a part of, if you would like to get their contact information, this is the time to ask. Yeah, so I would open up the floor right now.
Um, really quickly, I have a question.
Yeah, go ahead.
I'm not sure if you mentioned it throughout the presentation or any of the guest speakers mentioned it, or if I missed it, but what about gun licensing?
What is the specific question about gun licensing? Like, what is our opinion on it, or how do you do it?
Yeah, so like y'all's opinion on it, and like, do y'all think that it does have a contribution to the, the data that's the statistics that we just went over?
So the gun laws in Florida, to my knowledge, almost loosely non-existent. Is that correct? So what we're talking about now is a social construct most rules, laws, policies, everything is based on a social construct. And what I mean by that is that if it is socially accepted, that is the reason that it is implemented. Does that make sense? Like if somebody has agreed at a higher level, when I was talking about political hegemony earlier, that means that in Florida, there's a lot of people who don't feel the same way as they do in Virginia, or they don't feel the same way as they do in California or New York. I was about to say Texas, and that was a bad example. So again, all jokes aside, when we talk about these issues, people automatically assume because I'm a gun violence survivor that I'm anti-gun. And this is what I tell people. I'm a military veteran. I know how to use guns better than most people. That's why I don't carry them. So when I had I didn't go into depth, but I will tell you this, for the person who asked this question. Me having a gun, and I don't tell this story to people to discourage them from getting one, but if I had a gun on me the night that I got shot, the only thing that would have happened is that person would have died. And me and my best friend, who are both college graduates, business owners, family men, like we do all these amazing things, that would not have been the story. It would have been 2 Black men, 1 other man. You understand? And so I know for a fact, and I live with that, that I know that a gun wouldn't have stopped me from getting shot. It would not have happened. What I do encourage people to do is to be aware of the laws in their areas, to also be very familiar, because of the fact I'm military trained, I'm very familiar with guns, and I understand that a gun could never do anything by itself. That's why I encourage people to realize that that gun is literally just that. It takes a whole entire human being and 7 pounds of pressure to pull a trigger. So in order to do that, you have to know and be knowledgeable on what you're doing. You have to know what it is that makes your weapon fire. And that a little firing pin can change the whole trajectory and the fact that that weapon won't pull. These are the reasons why I argue that most people don't need to carry them, because they don't have that level of knowledge. You understand what I'm saying? I just had to help bury a 14-year-old child last week because his friends decided to go and take a locked up, it was a secured weapon, and they still got into it. And they accidentally shot their best friend. And he's gone forever. Guns can help protect people, but it can also create accidents. They can also create a life-changing, altering reality. So whatever it is that you do, and if you do decide to carry one, please understand that that could be the difference between you and your safety or you and your livelihood. But the things that we have to do to protect ourselves are more based on, do we feel safe around the people we interact with? Do we feel safe in the places that we spend our time and energy? I understand things happen, and there are things that happen in places that we can't predict. But ultimately, that's a long-winded answer that I try to give everybody to make sure that they understand. Because again, I'm a military veteran. I am not anti-guns, but I don't believe people that don't have the level of knowledge that most people do not have, we do not need them.
I just wanted to add to that when the newest law went into effect that you did not need a license for concealed carry in the state of Florida, I walked into my classrooms, and because I try and use humor, even though it's not always funny, and told them I could now be concealed carrying a weapon, a gun, wherever I want. And I know nothing of guns. The one time that I shot a gun, I think it's the kickback, it like hit me in the head. Like I should not have one, but I am legally allowed to go out tonight and get one, put it anywhere on my person that you can't see it, load it, do whatever I want with it, to my understanding. And to me, that's a huge problem, because I don't want to know that other people like me would be out there carrying a gun. I should not have that right to do that.
And I hope that answered your question for whomever that was.
Yeah, Red, do you have
Yeah, I did. Thank you so much, both of
No
you.
problem. Hope you ain't just saying that, neither. I know how it is sometimes.
Yeah, no, thank you guys for talking about that. I know when I was working on this presentation, that was something that I was debating on including in here, talking about the gun laws and even going into policing. But I also just obviously I want to talk about the public health approach, looking at those social determinants of health. But that really is an important factor. But sometimes I feel like there's so much focus on policing and sometimes the gun laws. And I wanted to be careful about what I talk about today. But I'm so glad, Red, that you asked that question, and that we were able to hear our guest speakers talk about that freely. So thank you guys. And we have just a couple more minutes. Does anyone have any last questions before we end the call?
Any questions at all? I wanted to add, you all, I don't know if people have been aware of, we just recently launched these Beyond the Bullet care kits. And I say recently, it's been years, but we have finally started to get them into different states. So in North Carolina and Asheville, the Justice Department brought me down. I did the training down there. We have some in Norfolk, Virginia, Brooklyn, New York. So these bleeding control kits, Beyond the Bullet bleeding control kits, they come with tourniquets, they have combat gauze, they have gloves inside of them. But the most important and powerful piece about this is that I fought this for a long time. I did not want to teach these classes. I took Stop the Bleed, obviously, as a military veteran. So I've been doing Stop the Bleed for almost since 2009, 2010. But when I became a gun violence survivor, I realized that Stop the Bleed program wasn't tailored to the communities for what we're experiencing at this level. So we took this and we created a whole program. We wrote a grant and it was all this big thing. But I wanted to share this because I encourage people to please, I think if I haven't already, I'll put my email and my phone number in the chat and let me know how we can try to connect and get these kits and these trainings into the cities and localities that you're in. Because I really think that we could change lives. But I have noticed that when we do teachers, especially in the schools, when young people go through the motions and see what it really takes, and they hear the stories of what it's like, and some of them have already been in situations where their friends have bled out in their hands, it's one of those things where we're trying to prevent exactly that. We're not training people to be afraid, but we want to make sure that we can save lives if necessary. So I wanted to share that. I don't think I mentioned earlier that we do have these kits that we are pushing out into the communities. My slogan at this point is I hope people put me out of business with that. I don't, you know, if I go out of business, that means that we don't need to push these kits anymore. Like that's literally, I hope y'all put me out of business because I don't want to have to push these. But until everybody knows this, for the last 4 months consecutively, I've had to go different candlelight visuals, and that's why I've shifted focus to pushing this even more and prioritizing this in different spaces. So I wanted to add that in case anybody else did not have any more questions for us.
Yeah, thanks for sharing that. And that's something that hopefully we'll continue to have a conversation outside of this with the leaders in this organization. We're in contact with a lot of people. Like I mentioned, Dr. Goldhagen would be great. I would love for you guys to talk. That would be a powerful conversation. Yeah, just like city officials and hope to hear from you, Katryne, too, and Cameron, with your kits and then your programs. I'm excited to see what will happen with this new partnership.
Absolutely.
Yeah, and I see Ebony, you dropped something in the chat. Is that something you wanted to share or?
Oh, that was just me highlighting Cameron's kit. It's an Instagram post where he's introducing and kind of sharing about it initially. But it's just a first nugget so that everyone on the call can have some insight into the power of what he's created in that space.
Yeah, thank you so much for doing that. So yeah,
Thank
everyone wants to take a look at that. That's in our chat. And yeah, please, 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 please reach out to Cameron. Katryne, I don't know if you want people reaching out to you, but if you want to,
They can. And
okay.
I want to reach out to Cameron because this was amazing. Thank you so much.
Yeah, awesome. So yeah, we're at our time. Um, I just wanted to thank everyone for being here. Oops. And if you have any further questions, like I mentioned, you could reach out to me, reach out to Sadia, reach out to Cameron or Katryne. And yeah, thank you everyone for being here. I hope you learned something and enjoyed this conversation. And hopefully you'll hear from us soon with what we're doing with this topic of gun violence. So yeah.
Yes, I put my number in
Thank
there, y'all.
you.
It's my actual phone number, so hit me up. We locked in now.
Wow, that's very brave of you, sharing your phone number. All
Thank
right,
you.
Sadia, thank
I
you.
just wanted to echo your sentiments. Thank you all for showing up on behalf of the Jacksonville Urban League Center of Advocacy and Social Justice. Be on the lookout. We have more town halls and more amazing interns just like Maya, who's out here doing the work, getting started and connecting you all with amazing professionals who are already doing the great work, such as Katryne and Cameron. So again, thank you to our speakers. Thank you, Maya, for putting together amazing presentation and finding these amazing speakers. You all have, I couldn't say you did a better job. So again, to our guests, thank you all for attending. This link will be posted to YouTube, so watch it as many times, share it as many times as you can. And again, just thank you all. Have a great Thursday evening and enjoy your weekend.